Welcome back to Juice and Java.
Angie Pati is here with us to share how to keep mental health awareness alive beyond SU's Mental Health Awareness Week. Angie, how you doing? Thanks for joining us.
Oh, I'm doing wonderful. Thanks for having
Wonderful.
me.
So can you describe to us why the university wanted to put on a week of events, to show mental health awareness, et cetera, all that jazz?
Yeah, absolutely. So Mental Health Awareness Week started last year by Joyce Lalonde, our queen, who was vice president of Student Association last year. And she basically walked into the Office of Health Promotion. She was like, we need to do more about mental health. And it's been really awesome to kind of follow in her footsteps because she did so much for mental health last year. I'm a neuroscience and psychology major, so I'm definitely passionate about it as well. And so last year it started as a student association initiative and then also brought in a lot of wonderful partners. This year what we wanted to do was make it even bigger, make it even better. I mean, it's only the second year that we've ever done it, but Student Association has made it a permanent initiative, so we're going to be working on it as after I graduate, after Joyce graduates, someone's going to be working on it and working on mental health. So Student Association, Active Minds at SU, NAMI at SU, the Counseling Center, the Office of Health Promotion, Hendricks Chapel, the Disability Cultural Center, and Delta Kappa Alpha. We all kind of came together to put this week because it's something that affects virtually everyone. If it doesn't affect you, it affects someone you know, someone you're friends with, or something of the sort. And so when looking at student association initiatives and when we are supposed to be advocating for our peers and being the representation of the student body, you really want to be hitting those issues that are affecting students and that are affecting the well-being of our students in every way, which is mental health.
So there's been a lot of focus on trying to make this week fun. So how did you guys accomplish that this year?
Yeah, it was awesome. So on Monday we did our kickoff event and we put inflatables on the quad and we had a dunk tank and there was like obstacle courses and like you could like joust with people. I jousted with James Franco. And we also gave out free t-shirts on Monday. And that was our kickoff event. The reason we wanted to do that is because we wanted to focus on the enjoyable nature of mental health for the kickoff event. So talking about mental health does not always have to be in a crisis mode. Sometimes, and a lot of times, it does have to be. It's a very difficult thing to work on. But you can also, like me talking to you right now, I'm having a great time. Like I'm working on my mental health, things like that. Yeah. Of course. But those type of things we really wanted to focus on. The Monday, the kickoff event was also really cool because it was also Shackathon. So we were also talking about inequity in mental health as well. And then throughout the week, we had events like that, like giving out t-shirts. On Thursday, we did kind of like a self-care day, yoga, meditation, dogs, things of the sort, because we really did want to focus on the continued conversation of mental health being, you don't only have to think about it in that kind of way, but a lot of times you will have to. So those are some of the things that we did. They were also mixed in with really hard events and like sad events, very real events. On Wednesday we did Send Silence Packing, which was sponsored by Active Minds, and that was 1,100 backpacks all across the quad that represented the number of college students who commit suicide every year. So we want to talk about all aspects of mental health, and every single day of the week had a different type of theme.
Yeah, Send Silence Packing was awesome, by the way. I saw that incredible display. As for other students, other than yourself, other than the people who are already involved, what resources, what initiatives should they be taking to get involved and to get this message across?
Yeah, I mean, I think there are specific resources, definitely, but also like having conversations with your peers and having conversations with whoever that is you're closest to, and realizing and changing kind of the rhetoric around it is really important as well. Like, it's okay to not be okay. It's okay to be struggling. It's okay to be resilient. So I think that's important as well. But then also there are wonderful resources on this campus. So we have the Counseling Center, the Office of Student Assistance, we have Health Services, we have the Office of Health Promotion. They do a lot of really wonderful programs to work in kind of prevention so that you don't need to be in this crisis mode. Sometimes that's way easier said than done and a lot more idealistic, but we can work with all these things in tandem to work towards positive mental health. But I think first and foremost is just making sure that you're okay with not being okay and talking to your friends, kind of keeping tabs on who you care about, and knowing that it might seem like everyone has their act together, but they might be struggling, and that's completely and totally fine and human.
Yes, thanks Angie so much for coming in and talking